Welcome to BUE Pharmacy Pharmacology program. Today I will going to introduce important information about extrapyramidal symptoms, which is related to psychiatric patients. Extrapyramidal symptom is a movement disorder that happens in patients who take typical and atypical antipsychotic drugs. But the atypical antipsychotics produce less motor disturbances than typical agents because they are more selective D2 blockers in the mesolimbic system than for basal ganglia. Extrapyramidal symptom is an umbrella term that describes a wide variety of movement disorder. They are divided into acute syndrome, which develop within hours or days of beginning treatment, and chronic syndrome, or tardive syndrome, which develop after a sustained period of exposure to the drug. Acute syndrome include acute dystonia, akathisia, Parkinsonian-like syndrome, where the tardive dyskinesia perhaps is the most common late occurring movement disorder. Firstly, acute dystonia. Acute dystonia is a sustained or repeated involuntary muscle contraction, which results in abnormal posture or movement. It's often frightening, painful, and may negatively impact the therapeutic relationship between the doctor and patient. The symptoms include sustained eye closure, eye rotation, jaw muscle contraction, neck, head, and trunk distortion. The treatment usually presents suddenly and requires urgent treatment. Intramuscular administration of anticholinergic drugs such as benztropine, which is usually effective within 20 minutes. Secondly, akathisia. Akathisia is a word of Greek origin meaning not to set. It usually begins to appear within days of beginning an antipsychotic or increasing its dose. The condition frequently becomes chronic if untreated and may worsen and persist on drug withdrawal. Akathisia may then exist in acute, chronic, and tardive forms. Clinical assessment for akathisia. Ask the patient about feeling of inner restlessness, desire to walk, difficulty sitting or standing still, and observe in patient leg swinging while sitting, rocking from foot to foot. The treatment. Akathisia may be resolved by dose reduction or by switching to an alternative antipsychotic. If this is not possible or desirable, then the treatment is propranolol, which has been shown to be effective in reducing both subjective and objective features of akathisia. And we have also newer treatment options. It was suggested that 5-hydroxytryptamine 2 receptor antagonism by counteracting dopamine D2 blockage may prevent the severity of akathisia. As such, there is now evidence to support the use of a variety of 5-HT2 antagonists in akathisia, such as cyproheptadine and trazodone. The third, Parkinsonian-like symptom. The symptom usually emerges within a few days of starting the offending drug, but may emerge slowly over several weeks. The symptoms include bradykinesia, hypokinesia, tremors, and rigidity. The treatment is usually treated by switching to a drug less likely to be associated with such effects, where switching antipsychotics is not practical. Anticholinergic drugs such as benztropine are effective, but not without their own adverse effects. Fourthly, tardive dyskinesia. PD generally occurs after long-term antipsychotic therapy. It's a complex neurological syndrome that consists of hyperkinetic involuntary movement. The symptoms include tongue protrusion, lip licking. The treatment. It's common to practice to withdraw the offending antipsychotic and to substitute with another drug. The use of clozapine, quetiapine, olanzapine is effective. Also, we can use benzodiazepine and vitamin E. Finally, clinicals should remain mindful for the possible development of EPS when choosing the antipsychotic and to ensure that patients are symmetrically monitored. 1. Also, the patient should have support from his family, friends, and society.
Free. created using Powtoon.